Hello, today we're going to talk about root cause analysis, basically identifying the steps and implementing processes and solutions. I will start by reading the case scenario of a patient named JB. So JB is an 84-year-old male who was admitted to the hospital for CHF, shortness of breath, failure to thrive, and diabetes. He has some cardiac history and pancreatitis and BPH. His initial vital signs were blood pressure 175/90, heart rate is 90, respiratory rate 24, 90% oxygen saturation on room air, and pain 5 out of 10. He was started on some routine PO meds with Vicodin as a PRN. He was given Vicodin during the day shift by the day shift nurse. After change of shift to night shift, patient's vital signs upon night shift was blood pressure is 180/90, heart rate's 80, respiratory rate 28, 87% on room air. Pain is now 6 out of 10. The night nurse notified the doctor. Patient was started on 2 liters of oxygen and was also given morphine 2 milligrams IV push. Patient seemed anxious from the night before and was given Ativan 0.25 milligrams. On top of that, at about 9 o'clock p.m., the wife requested for patient to get something to sleep as he was restless. The night nurse then went ahead and gave patient Restoril 15 milligrams. By midnight, vital signs was rechecked. Blood pressure is now 200/110, heart rate's 90, respiratory rate 28. He's now 88% on 2 liters of oxygen. Abdominal pain is now 10 out of 10. He is now very restless and unable to answer any questions. The doctor was notified. Oxygen was increased to 4 liters. Another 2 milligrams of morphine was given, and a stat CT scan and labs were ordered. At 1 in the morning, the radiology called for the nurse to bring the patient down for the CAT scan. The nurse grabbed a portable oxygen tank and connected patient to the tank, putting patient at 4 liters per minute. The transporter came to take patient to radiology. Once he got to radiology, he was instructed by the radiology tech to leave patient in the hallway as he will be with patient shortly. Patient was left alone in the hallway without anyone in sight. Radiology was occupied and actually didn't come back for patient for 20 minutes. When the radiology tech returned, patient was found not responsive and not breathing. The O2 tank was found empty. He called for help and initiated CPR. Patient was resuscitated and was brought to ICU.